Tuesday. I'm so excited to welcome you all today to our webinar to mark the upcoming release of our report, A Snapshot of Poverty Among Quebec's English-Speaking Communities. So in today's webinar, we'll be previewing our upcoming report and providing an overview of some of the key findings from our project. The report is part of our growing portfolio on the economic and employment status of English-speaking Quebecers across the province. And the full report will be released on Tuesday, September 5th. And finally, the webinar is being recorded and the recording will be available on our YouTube channel. So feel free to find us there. Let me just change my slide here. So that's the end of our housekeeping. Before I move any further, I'd like just to acknowledge that CURT is currently situated on unceded Indigenous land. So the Gagnon Nation is recognized as the custodian of the land and waters. And Tiohtià:ke, or Montreal, is historically known as a gathering place for many First Nations. And today it is home to a diverse Indigenous population, including the Haudenosaunee and Anishinaabe nations. So from there, I'll transition to my presentation proper. And as I said, we'll have a Q&A at the end. So any comments or questions about the presentation or that arise throughout the course of it, please feel free to drop in the Q&A box the bottom of your screen. And we'll see if we can work through some of those at the end, or we'll have some researchers on hand to answer some of the more smaller questions, perhaps. So I'll start by telling you a little bit about CURT. So we are a nonprofit multi-stakeholder initiative with the goal of advancing research to understand and address the employment issues and employability concerns facing English speakers in Quebec and across Quebec. And we work through a diverse network of stakeholders across the community, education, and government sectors to address the issues that we identify and advance solutions. So we have two main pillars to our work. The first is research. So we conduct and advance research to develop a deeper understanding of the issues within the employability landscape for English speakers in the province, and to identify solutions and flesh out some of these responses. And then our other pillar is engagement. So we work with the stakeholders that I've mentioned, not only to disseminate our research after the fact, but to incorporate community and multi-sectoral perspectives into the identification of our research goals and our research design. And that's why, as you can see here, we have what our executive director calls our virtuous circle, where our engagement informs our research, which in turn informs our engagement. And today's webinar will be a bit of a microcosm of that approach. So we'll be presenting primarily some quantitative data overviewing the situation of English speakers experiencing poverty across Quebec. And then we'll be bringing in our two panelists to discuss our findings and provide a bit more qualitative insights or insights that might help to contextualize some of the data points that we're seeing. So our specific objective is to demonstrate the linguistic dimension of poverty in Quebec to inform the province's policy responses to poverty and support the goal of a poverty-free Quebec. And I'll now tell you a little bit how we do that in this report in particular, in this presentation. So we draw upon data from the 2021 Census of Canada, and we look at a couple different factors that are related to poverty. So this includes unemployment rate data, income data, and data for individuals living in low income status. And then we also look at poverty rate data in particular. And I'll just tell you a little bit about how that's actually calculated by Statistics Canada. So they use something called the Market Basket Measure, or the MBM, if you've seen that acronym before. And what the MBM does is it measures the cost of a particular basket of goods and services that would be necessary to maintain a modest and basic kind of standard of living. And it uses that as a threshold to understand individuals and households that are able to maintain that standard of living, and individuals and households that are not. And those who are not are categorized as living in poverty. So I'll note that there are a couple perhaps limitations to poverty rate data. As you might imagine, this captures a very specific image of poverty. There are some things that we're just not able to capture necessarily in the quantitative data. So this might include issues of homelessness or people living in unstable living conditions. And additionally, poverty rate or the market basket measure, the MBM measure, is not applied on reserves or in northern communities because the metrics to determine the kind of affordability of the basket of goods used to calculate the market-based measure are a little bit more complex. And the MBM measure isn't able to capture them in their entirety. So there are these kind of caveats to this data. However, it remains one of the most comprehensive source of data on poverty in Canada and in Quebec in particular. And this is, of course, why we strive to put that data into conversation with the perspectives and experiences of individuals and communities, as we'll be doing during our conversation following the presentation. So I'll now present some of the quantitative findings. So I'll highlight quickly some of the key stats that we've drawn out. So English speakers in Quebec experience a poverty rate almost twice as high as French speakers in Quebec. So 10% versus 5.8% of English speakers, 10% of English speakers versus 5.8% of French speakers are living in poverty in Quebec. And following from this, English speakers represent almost 15% of the population in Quebec, but 23% of all Quebecers living in poverty. So they're disproportionately represented in the community living in poverty in Quebec. And then within the English-speaking community in particular, youth and seniors experience disproportionately high rates of poverty, as do visible minorities and non-permanent residents in particular. So now I'll walk you through some of the more specific findings with a couple of graphics. And I'll note that if these are images or data that you'd like to sit with a little bit longer, all of these will be available in our report on the 5th, at which point you'll be able to review the full data sets or to view the images for a little bit longer. In this graph, what we're looking at are English speakers in red and French speakers in blue on their poverty rates by region in the province. So we'll see across the board, with the exception of Côte-Nord, English speakers have higher rates of poverty in every region of Quebec. And these are particularly high in the regions of Mauricie at 13.3%, Bas-Saint-Laurent with 13%, and Montreal with 12.6% of all English speakers living in poverty. Among French speakers, the metrics are a little bit different. So English speakers or French speakers in Montreal experience the highest rate of poverty out of any French-speaking community across the regions. And it's significantly higher in Montreal for this group. Perfect. And now we'll see poverty rate according to age in Quebec. And again, we have English speakers in red and French speakers in blue. And what we see among English speakers, again, is youth have age 15 to 24 have the highest rate of poverty of any age group among the English speaking community, followed by individuals aged 25 to 34, and then individuals aged 55 to 64. Among French speakers, however, it's this last group, individuals aged 55 to 64, who have the highest poverty rate. So there's, we can see disproportionately high rates of poverty among seniors in particular in both age groups or mature individuals. But we also see the English-speaking youth in particular experiencing a poverty rate double that of French-speaking youth, which highlights or suggests particular barriers faced by or unique to English-speaking youth. So here we'll see a poverty rate now sliced according to gender. So we'll see that in among both English and French speakers, men have a moderately higher rate of poverty as opposed to women. However, the disparity is slightly higher among English speakers as opposed to French speakers. So English-speaking men have a poverty rate that is 0.9 percentage points higher than English-speaking women, whereas French-speaking men have a poverty rate that is 0.2 percentage points higher than that of French-speaking women. So in this table, we'll look at poverty rates according to visible minority identity. We're displaying this information in a table because it's a few too many groups to present coherently in a graph. What we see on the left are the different visible minority communities that Statistics Canada uses. And at the top, we have the total population, and following that, the total visible minority population. So all the subsequent visible minorities categorized into one group. So we'll see that among these different communities, English-speaking visible minorities have the highest rate of poverty at 15.1%, and that's just towards the top left of the screen of the first column, followed by French-speaking visible minorities at 9.9%, and then English-speaking visible minorities at the bottom with 7.1%, and French-speaking non-visible minorities at the bottom with 5.3%. So we'll see that belonging to a visible minority or being a visible minority is also correlated with higher rates of poverty. We'll also see that all of the visible minority groups who are English speakers have higher rates of poverty as compared to French speakers. These are peak among the Korean community who speak English as their first official language. Almost a quarter of these individuals are living in poverty, as well as the South Asian and Chinese communities that speak English as for their first official language have very high rates of poverty as well, almost double those of their French-speaking counterparts. And I'll note that among the visible minority communities within the English-speaking population of Quebec, the South Asian community is the largest. And finally, we'll look at poverty rate by immigration status in Quebec. So we see in the bar second from the left that English-speaking immigrants have a higher poverty rate than French-speaking immigrants at 8.6% compared to 6.9%. But then if we look to the right hand of the graph, non-permanent residents, both English and French speakers, have significantly higher rates of poverty. There is some linguistic disparity here. So we do see that English-speaking non-permanent residents do have a significantly higher rate of poverty as compared to French-speaking non-permanent residents. But it's also clear just looking at this data that non-permanent residents as a whole are facing very specific and unique barriers and factors that increase or affect their vulnerability to poverty, such that they do experience disproportionately high rates of poverty. So that's some of the quantitative data that we've pulled out and highlighted in our report. And now I'll walk through just a couple of the issues that are linked to some of these data points that we're seeing. So first I'll talk about language-based disparities. As we saw in the data, among different groups or different demographics within both the French and English-speaking communities, English speakers do experience a higher rate of poverty. And this points to the need to adopt a linguistic lens when we're seeking to review and understand poverty data and the factors that contribute to poverty. In previous research that PRITS conducted, we've looked at a lack of French language proficiency and a lack of French language learning programming, which can often affect the employment experiences or the unemployment rates of English speakers. And there are, we know, kind of following from that unemployment is linked to or can correlate to higher rates of poverty. We also identified access to wraparound supports as a key issue. I'll note that PERT, again, focuses on employment, and we understand that to pursue employment or employment programming or French language training, individuals often need an array of periphery supports or to have their basic needs met such that they're able to pursue different programming options or different job opportunities. And these include basic necessities like food security programs, access to transportation, housing, childcare, and mental and physical health care. And these are essential both to what we focus on, the pursuit of employment programming or meaningful employment, but these things are also necessary to help to lift individuals out of poverty, to help them exit poverty. And it's following from this necessary to have these basic services accessible in English such that these individuals are able again to meet their basic needs. And this is the case both in employment sectors as well as other sectors such as healthcare and social assistance. And there's also a need for specific resources that can help English speakers access services that are currently available in French. So these include things like accompaniment or translated documents. And then just the last two issues that we'll highlight. So the first is regional disparities. We know that English speakers in the regions tend to experience higher unemployment rates and learn lower incomes than both French speakers living in those same regions, as well as English speakers living in other regions. And we also see that several of the very high poverty rates for English speakers are in some of the regions, so Bas-Saint-Laurent, for example. So what we need is more qualitative data to examine the factors that contribute to these high unemployment rates, these lower incomes, which often can be correlated or relate to poverty, as well as the high poverty rates in particular. And finally, we know that there are specific groups that are more vulnerable to poverty. So these include English-speaking visible minorities, English-speaking immigrants, and English-speaking non-permanent residents. And we know that vulnerable groups benefit from employment programming and other programming that consider their specific circumstances and the unique barriers that they face and take those into account in program design and program offering in order to successfully support these different groups. So I'll close my presentation there. Although I will briefly plug that we have two upcoming webinars. I'll highlight the second one first. We're in about a month, a little less than that. We're discussing and mapping employment supports for Quebec's immigrant and racialized and English-speaking communities, which directly relates to the subject of identifying tailored supports for these communities. And next week, we'll have a webinar on the topic of international language learning approaches, if you're interested in the subject of language learning, linguistic disparities, all those things. Perfect. So thank you so much. I will now stop sharing my screen and we'll transition to the panel portion of the webinar today. So I'll perhaps ask Rachel and Jennifer to turn on their cameras and their microphones. Perfect. Hello.
Thanks.
So I'm going to go ahead and just give a brief introduction of you two, and then we'll dive into some of the questions that we have prepared today. So Rachel and Jennifer are our expert panelists who are working to support English-speaking communities in Quebec. First, I'll introduce Rachel. So Rachel Hunting is a graduate of Bishop's University in the field of sociology and has been working in community development since 2008, with a particular focus on the vitality of Quebec's English-speaking minority language community, health and social services, and youth. Prior to beginning her role with the Regional Development Network in 2021, Rachel was the Executive Director of the Townshippers Association for just shy of a decade. In 2015, she was appointed to the board of directors for the CS de l'Institut, where she continues to represent community organization expertise as an independent director and is president of its governance and ethics committee and is an active member of its human resources and communication committee. Rachel's also an active member of the board of directors here at PRU. Welcome, Rachel. Delighted to have you. And next we have Jennifer Cooke. So Jennifer has worked with the CHSSN, the Community Health and Social Service Network, as a regional development officer for the Greater Montreal area since 2019. She has more than 20 years of experience working across the province, supporting and facilitating nonprofit organizations, big and small, in social change and community development. She has won multiple awards for her work in the community sector and has been a catalyst of multiple local initiatives, such as a Pôle d'économie sociale Laurentienne, and provincial initiatives such as the Coalition de Jeunes et Prix that continue to this day. Jennifer has a passion for graphic facilitation, mapping out systems, creating innovative tools, and connecting the dots, which is hopefully very handy for our conversation, directly relevant to our goals and conversation for today. So I'll perhaps start by directing a question to you, Rachel. And then Jennifer, you'll have the right of response following Rachel's answer. So in our presentation, we saw data highlighting disparities among English-speaking communities in the regions of Quebec. But we also know that statistics aren't always able to tell us everything or give us a full picture. So could you discuss some of the factors that impact English speakers' proximity to poverty in the regions?
Sure. You touched on it just towards the end of your presentation when you were talking about not only the language disparities, but also the wraparound supports. And I think Jennifer will probably agree with me. It's not necessarily a question. I mean, poverty is a situation that English and French speakers both find themselves in, but poverty is also a situation that is exacerbated by which language community you find yourself being a member of. And what we see is it's often linked to a lack of access, but also availability of those wraparound services that you were talking about. So, you know, the mental health care, the employability services, educational opportunities, and opportunities for individuals to change the cycle of poverty that they may be experiencing. When you find yourself in a region, typically the farther you are from a large urban center, the infrastructure looks different. So you may not have access to post-secondary opportunities in English or in French unless you leave the region that you're from. And more often than not, unfortunately, individuals who leave to pursue higher education don't necessarily return to those communities in those regions that they're from. And that leads to, you know, other issues. So poverty is not an issue that employability services can address alone, education can address alone, or healthcare. It's a situation that needs the wraparound approach. And I think that I'll wrap it up there because I think Jen can jump in with some extra information and an insight into the more urban sectors as well.
Yeah, thanks, Rachel. Yeah, I definitely agree. Like the whole idea of breaking down sectorial discussions on poverty is super important, but it's also really, really difficult. You know, mobilizing many partners together to have that discussion. So when you're in the regions, there are certain issues, and when you're in an urban center, you're as we saw in your data, certain communities are really suffering because they are not only living one level of poverty in a sense, because poverty is on so many multiple levels. And the other thing I wanted to identify is that poverty is in itself is so complex because not everyone within poverty suffers at the same levels because of that access to services and how well they are navigating the systems. So if you're in a place where navigation is more difficult because of access, you are definitely not going to be able to get to the services you need compared to other individuals who might be able to access services because they're part of a community, or they belong to something bigger that will help them access services.
Thank you so much both for your responses. I'll now pose a question to you, Jennifer, and Rachel. You'll have the opportunity to respond afterwards as well. How do mental and physical health, and I think this ties directly into what we were just discussing about access to different services and wraparound supports in particular. So how do mental and physical health and access to healthcare services affect one's proximity to poverty? So I'm thinking about how health and healthcare related issues can contribute to or might cause one to live in poverty, but also how health issues can arise from living in poverty. So I'd love if you could speak perhaps a little bit to what the cycle looks like in English-speaking communities in particular.
Yeah, definitely. And I think, again, we're coming back to that access piece and vulnerability and the multiple levels of vulnerability depending on each community. So in our recent crop survey that was provincial wide, and we had about 4,000 individuals who replied, something that's really interesting is 33% of the survey respondents were not served in English at a CLC, and then 32% were not served in English by Info Santé. So if you're looking at that kind of level of access, automatically people are discouraged and they're not going further in their needs as far as health issues are concerned. And then when we're looking at mental health, I'd like to look a little bit at youth, because you brought it up, and obviously it's a group that really we're very concerned about, because we, as well, in some of our surveys, youth are not accessing services. In one of our surveys, 40% of the youth that we spoke to did not even have access to a family doctor. And a lot of the anxiety and stress they're living is linked as well to their capacity to be employed or get the services they need. And then when we're looking at services, in the private sector, 9% of English speakers are going to the private sector for health services compared to 4% of Francophones, which is quite a huge disparity as well. Again, people within poverty are not having those kinds of access to other services because they haven't got the financial capacity. Obviously, the elephant in the room is lodging as well, which is a huge issue, and that has within social determinants of health, that has a huge impact. So when you're looking in an urban center, you're looking at people putting such a large percentage of their income into lodging, so everything else is pushed down the ladder of how they're able to look after themselves. And then another, I just want to add as well, another piece that was really interesting in one of our surveys that we did with men around psychological distress. And there's a huge disparity between men and in the English community and those in the French community. So those having psychological distress, 19% compared to 12%. Suicidal ideation, 11% to 6%. Visiting a doctor for help, English speakers 37%, French speakers 49%. So it speaks back to that youth piece that you showed earlier, where those young men who are fathers who have been surveyed are not going to get the help they need, and then that creates a circle of poverty as well, because they're not able to work as well as they would. They're not able to stay in employment, etc. I can keep going.
That's maybe wonderful. I'll put some of the the research and the reports that CHSSN has produced and that you're discussing, I'll put those in the chat.
Definitely go to our website because there's a lot of very interest in the document center. There's a lot of very interest.
Absolutely. Thank you. Rachel, I'll now flip it over to you for the same question.
Yeah, I mean, I won't add too much to what Jennifer said. I'll agree with all of it. In the regions where RDN is active and where our membership is active, the housing issue in particular goes beyond the percentage of your income that you're putting towards housing. In some cases, there is no available housing in communities. And when you talk about trying to, think outside the box and innovate and create opportunities to, improve the vitality of vulnerable populations, if you're unable to bring in workforce or house, people who are active in the labor force, it's increasingly difficult for those communities to even create opportunities for themselves when there isn't access to to anything that's readily available. And I would also add that, investments and service providers, Quebec is a leader in Canada in terms of, social policies and, policies particularly aimed at decreasing poverty. But if you have to ask two questions before you can find out if you have access to something, the first one being, is there a service provider in my region or in my locality or easily accessed, and not just a language basis, but also transportation wise? And then if there's a yes there, the second question is, that service provider able to offer me a service in a language that I can understand at a level that I can work with? Because Jen touched on this a little bit as well, but in order for somebody to be employable, there's so much more that goes into, just, it's not about your income and just getting a job and becoming part of the workforce. For many individuals, there are a lot of pieces that have to fall into place for them to be in that position to even go into a public service provider who is an employment service provider. So I think, again, it goes back to the wraparound services and your level of access to them or not.
I'd just like to add to what Rachel said, one little thing, because I think this is really distressing as far as housing and access to social services. Recently, in a discussion with youth mental health program directors, we told that youth from the Gaspé who couldn't find lodging were being sent to Montreal for emergency services. But that is very distressing in the sense that you're taking an individual out of their community, out of their environment where they could have some success, and putting them in a foreign urban center. So I think these are really important, because sometimes access to services, we may say, oh, well, there is a service in this area, but then the person has to travel really far to get the service, especially if we're looking at specialized services.
Yeah, absolutely.
So I'll pose the next question to you, Rachel. Again, this maybe follows directly from our conversation. So the government of Quebec is currently developing its 4th action plan to combat poverty and social exclusion in the province. And the ultimate goal of the province's anti-poverty legislation is a poverty-free Quebec. So I'm curious, how would you like to see English speakers involved in this conversation?
Well, I mean, I think you nailed it there. I'd like to see them involved in this conversation. I think it's really important, no matter what vulnerable population you're working on behalf of or developing a policy to impact, you have to include them. They are experts in the issue that is trying to be addressed because they're living it. And I think that sometimes government forgets that, and sometimes they remember it in the wrong way, in that there will be investments made into community services, but they're not necessarily community-led or initiatives that are of the community. So, there's buy-in issues, there's impact issues when the community is left out of the conversation. And I think that investments are wonderful, but they need to be made with, you know, the consultation and the input of the communities that are impacted by the policies. Absolutely.
And Jennifer, any follow-up?
Yeah, I just wanted to add that in our recommendation, following on what Rachel's saying, is we really want to make our communities visible, but within the policy itself, it has to be written. It has to be written that our communities have these issues, and different communities within our communities have issues, and all of that has to be put into the policy so that it's not lost among other communities that might be larger than our community and have different issues than we have, and then it becomes watered down and it's not seen, so then people aren't taking as much notice of the issue. So
that's a really good point, Jennifer. Using demographic weight as a measure for levels of investments or not is also something that doesn't help the English-speaking community out in Quebec's regions, because there just aren't large numbers of them in some cases. So to run a program because you have X number of participants or not goes back to access, but access is so much more than just, either physically presenting yourself at a service provider. It's things like that. So access to investments, access to consultations, and what my colleague expressed, being included in the policy and being recognized as a community for having these issues. Because if there aren't targeted measures, as Jennifer said, they'll get diluted and lost in the sea of the wider initiatives.
Absolutely. And I'll maybe just briefly note, so as a part of the development of the 4th Action Plan to combat poverty in Quebec, the government of Quebec recently had an open call for consultations and submissions on the subject of combating poverty in the province. And CHSSN and RDN, I believe as well, all submitted a brief, and I think we all have very similar themes, perhaps from our different lenses as organizations. But the fact that we're all able to echo each other builds a little bit on that solidarity, I think, that we need to see.
Oh, absolutely.
Thank you. Okay, so I'll pose the last question to you, Jennifer. So drawing on your previous experience, can you tell us about some policies or programming that have created a positive social change or helped to combat poverty and social exclusion within English-speaking communities at the local level?
Okay, so I think it's definitely success is created through diving deeply into whatever situation or problematic that you're working on, and really helping people to break those barriers and help within their vulnerabilities. And using cultural adaptation is a huge piece, and especially since we've seen in our in the research that you've been doing and the numbers that are coming out, that very vulnerable communities need very direct kinds of services that are adapted to their needs. So I can give an example of O3 in Montreal that works out of social housing, works directly with parents, works with the children, works with right at the source, and is in direct relationship with those individuals that need help, and therefore the success is not just a blanket kind of solution. It's a very individualized solution for the group of individuals that they're working with, depending on the different vulnerable communities that you're working with as well. Whether it's in the city or outside of the city, then you have to think as well of access. So some of our programs now, I'll give an example. Vent Over Tea has been putting a mental health program out, which is not only accessible to individuals in Montreal, but now they're having programs being placed across the province in different regions because of the success that they had online during the pandemic. So we're like building on something that's working and investing in that and bringing it out to the regions, whether it be online or in person, through training. I think it's really important, enabling other organizations to work with the same kinds of different programs and helping them accomplish that through training and sharing. I think sharing within our community is really important, and CHSN through our model, it's part of our mobilization and outreach that we do on the ground with all our networks across the province. Rachel, I don't know if you want to add a little regional.
I would add proximity work, you know, meeting individuals, vulnerable individuals where they are, and not expecting them to come into situations that they're not comfortable being in, I think is an example of initiatives that are having positive impacts in vulnerable and rural communities. And also, I think the grassroots, you know, the community-led initiatives. And Jennifer touched on something very quickly, but building on successful initiatives. I think that's maybe a message more for funders or anyone who's listening from that perspective. But it's not always the best thing to do to innovate and create something new. Sometimes supporting and beefing up an existing initiative that is, you know, having that impact, but at a smaller level, is the way to go. You know, so I would rethink there. Sometimes, as an organization, you feel like you're always asked to put something new on the table when you know that, you know, this works. So I think that's an important thing to remember.
Mm-hmm. Sustainable funding is
sustainable funding. Yep.
It's so important. It's a project 1 year, a new project every year. It puts so much stress on organizations.
Absolutely.
Absolutely.
And, you know, organizations doing the kind of work that Jennifer described and the kind of work that our network's members do, those are relationship building situations and partnership, you know, partnership collaborative initiatives. And if you have sustainable funding, it's much easier to keep those partnerships going at a level where you're active and you're doing things together. When you have project funding 1 or 2 years even, and you have, you know, a change in personnel that goes along with, you know, the beginning and the end of a project, it's difficult to maintain those relationships, and it's difficult to maintain that momentum. And I think that's important as well.
Absolutely. I see some thumbs up and some heart reacts. I think indicating that that's a shared sentiment. So I'll now transition us to our audience Q&A. So I'll just take a moment and remind our attendees that if you'd like, you're more than welcome to write a question into the question box for our panelists. So I'll start us off with a question from Lorraine. Hello, Lorraine. Why do you think poverty rates are higher for men than for women? And perhaps I'll direct this to Jennifer initially, just because you talked a little bit about access to healthcare services and statistics for men in particular, and then we'll go to Rachel.
For sure. Like, I think from what we're seeing, men are, like, from a health perspective, men are not dealing with stress as well as women are, maybe, as far as like when they have got any health issue, mental health or other, they are not getting the services that they should be getting. Certain groups, as I mentioned, like Ventova T, have had some success with a younger age group of men. So that is really promising, and having them come in. And I think that goes into the conversation of how do we, sometimes it's not, the service is actually there. It's actually how do you link the individual to the service. So sometimes the problem isn't access to service from the fact that there is no service for the individual. The problem is access to service because the person is not being able to they're not comfortable going to the service. And I think that we have to always look at that with that lens as well. And Rachel mentioned it as well, as far as like reaching out to those vulnerable communities. Sometimes it's creating trust, right? You have to create trust. So there's the trust issue, I think, with men as well. And then there's the traditional kind of male, I'm not the one. They feel there's the feeling of not being able to ask for help. I think it will be looked negatively. There's a lot of stigma.
Yeah, Rachel, do you want to chime in or build on anything?
I don't want to say too much because this is not my wheelhouse, but I would be curious to see a gender breakdown. Maybe this is maybe for you to have a look at it, but a gender analysis of industries that are resource-based and that are changing. And if there are more men involved traditionally in those industries that are having, either difficulties or being completely re-looked at, and if that group of individuals needs to do upskilling or finds themselves in experiencing a different employment situation than they're used to, that may have an impact on the level of poverty for men. But that's a research question. That's not really a statement. So I don't want to make a statement, but I would be curious and interested to see if there's a correlation there.
Definitely, that's a very compelling area of research, certainly. I am confident that somebody on the research team is writing this down in our on our agendas currently. That transitions to, I don't see any other questions in the chat currently, so I had a question that I wanted to ask. You've identified one area, but where if you were to conduct or to direct particular research on poverty in Quebec, are there any specific areas or issues or groups that you think would benefit from additional research? Or more broadly, what research do you think is needed on the poverty situation of English speakers in Quebec? Feel free, anyone, or I can.
Well, I mean, I just mentioned one. I'm not sure. There's a lot of data that's out there, but I think always the language lens. The more we can apply a language lens to existing data or to stats that are available for another community, I think if we can have a deeper dive into what's going on in the linguistic community, and not just our language community, but official language minority communities across Canada, it's always interesting to see how different minority communities, visible minority communities, how they're dealing with issues of poverty, issues linked to poverty, access, employment, all of those sectors. I think it's always good to have a look at what other folks are doing and see if there's something that we can learn from them, or be inspired to do in our own communities or research wise.
I'd just like to add that I think within the ethnocultural communities that, and the visible minority, like there has to be obviously the linguistic lens, but also, again, I'm going to emphasize cultural adaptation and how the research is done, because if the research is not done in a way that's respectful or trusting for different communities, we're not going to get the information. How the information is processed and how it's collected is really, really important with all communities, but definitely with the more vulnerable communities. And I think that's really important research, because I think we're missing research there.
Absolutely. And that, I think, kind of brings us full circle to the importance of building relationships and developing that trust over time, and the types of resources and funding models that allow you to do that meaningfully and in an appropriate way. Absolutely. Wonderful. Did either of you have any other further insights or closing thoughts that you'd like to share with us today?
No, I just wanted to say thank you for the opportunity.
Oh, thank you. It is a pleasure, as always, to have you to have this conversation with both of you. Thank you so very much for joining us. Um, I'll go ahead and bring our webinar to a close. I'd like to thank our panelists and audience for your insights and particularly Rachel and Jennifer for your conversation. It was very constructive. Thank you.